Welcome everyone to this latest segment of our series of Sound Mind. This segment will focus on discussion of a concept that may be unfamiliar to many of our viewers, and that is the idea of a continuum of care, that is what a person with dementia and his family members really need to have. And what we mean by that is that people with dementia have different needs at different times in the process and depending on the environments that they're in. So to address this issue, we have a wonderful panel with us in this particular segment. Each of them are experts in their areas, and we're really happy to be able to address this topic in some depth. I'm sure that you will learn a great deal from listening to this. I'm Dolores Gallagher-Thompson. I'm a research professor in the Department of Psychiatry at Stanford, and I'm also a psychologist, practicing clinician, and I'm the host of this series. I'd like to begin by introducing our first panelist, and that is Dr. Marina Martin. Dr. Martin is a geriatrician with many years of experience in the primary care setting. And Dr. Martin is a clinical assistant professor at Stanford, and she's also the section chief of geriatric medicine. So Dr. Martin is going to explain to us what are some of the needs of the person with dementia and some of the issues that you face in working with those patients in the primary care setting. So Dr. Martin, take it away.
Thank you, Dolores. Well, ideally, the primary care clinic should serve as a medical home for patients with dementia and their families, and that they should receive both really good assessment and treatment and assistance in managing their condition in their primary care clinic. For assessment, the primary things that the primary care physician should look for include, how advanced is the dementia and the cognitive impairment, such that how is it affecting their day-to-day function? Are they able to do the basic things for themselves still, including bathing, dressing, using the bathroom, or do they need assistance with those things? And all the way up to how are they doing with kind of higher level functions, so things like driving and managing their own medications or finances. All of that should be assessed in the primary care setting. In addition, there are a lot of non-cognitive symptoms of dementia, primarily mood-related, and up to 80% of people with dementia will have problems with agitation or aggression. And often those symptoms are the most distressing for the families and the patients, and rather than the memory loss itself. And so helping assessing that and helping families to manage those kinds of symptoms is also a really important task of the primary care clinic. The other thing that we try to assess regularly in our clinic is what kind of support structure is around the patient, who are their caregivers and supporters, and are they safe? Because a lot of times people lose their safety as they progress in this disease. In terms of management in the primary care clinic, we try to help educate the patient and their family in particular about the natural progression of this disease and what they can expect and what they can do to kind of plan ahead. And that could include caregiver support, which is a major aspect of what we do, because it's quite hard to take care of a loved one who has dementia. We also try to encourage activities that will help slow cognitive loss and slow memory loss. The primary one being physical activity. Physical activity has been shown again and again to be very important for maintaining cognitive function and preventing some of the problems that can happen as the disease advances, including balance trouble and falls. So physical function is really important, and physical activity. Also social connectedness and avoiding isolation. So it's very important that the person and their caregiver not become very isolated in this disease and lose that kind of social input that's so important to quality of life and to maintaining an active mind.
So it sounds as if in the primary care setting you do more than treat their medical problems. Is that correct?
That is correct. We really try to look at the person and their caregivers as a whole system and to look at their quality of life and to help them to achieve the maximum possible quality of life given this difficult diagnosis. And oftentimes that requires bringing in other team members as well to help.
Yeah. Yeah, I was going to ask you about that because it sounds like it's a team approach that the physician by themselves probably can't do all of these things. And so
that is correct. Ideally, you would have a physician, nurses, and social work is really important, as well as partnering with community agencies and community-based resources that are really critical to helping people with dementia and their family members.
So I know you're talking about the senior care clinic at Stanford. In the community, are there similar primary care services available?
Sometimes it's harder to find those in the community with physicians and nurses and social workers, especially trained in care of older adults. However, there are some there. And also, there are other supports in that we'll talk about soon in both the hospital system and healthcare system and in the community to add on if that's missing in the primary care clinic.
Great. Thank you very much. I think we've learned a lot from this presentation. And now I think we'd like to move on to thinking about what happens to the person with dementia when they are no longer able to be an outpatient, but they become ill enough that they need to be inpatient, so they become hospitalized. And in that case, their needs are different again, and the kinds of services are going to be different as well. So to address that issue, we have Dr. Rita Ghatak. Dr. Ghatak is a psychologist and a well-known gerontologist who has published and done research in this field and has influenced Stanford policy over the years. In particular, she is the founder and the director of the Aging Adult Services Program. And this program was one of the first in the country to take this concept of continuum of care and embody it in clinical practice. So, Dr. Ghatak, can you tell us about that particular program, what it has to offer, and why it's important?
Thank you so much for including me in this panel. So I think exactly what Marina just mentioned, that the needs of the patient with dementia, once you're newly diagnosed to someone that progresses in the condition, and those are noteworthy. When that particular patient, for whatever reasons, could be trauma, could be a fall, or could be an elective procedure, comes into the hospital, it is a difficult situation because they have been moved from their own familiar setting to a new setting. And in the hospital, it's all about treatment and procedures and moving from one particular specialty to the other. So in those cases, it is a hard journey for the patient with dementia. So some of the things that we find are important for family members to learn and know about is the fact that there needs to be a diagnosis of the dementia. Oftentimes a patient may come in, they may have reported symptoms, or the families may have noticed it, but they haven't really been formally diagnosed. They may have not been part of a primary care setting like Dr. Martin's setting. And in that case, it is really important to first of all screen them and know what we are dealing with, because a patient with dementia needs a different kind of care planning, needs a different kind of an integrated team approach. So that's number one. Also, one more thing we see in inpatient settings is when patients with cognitive impairment have a predisposition towards delirium, which is a somewhat frightening, a sudden confusional state. So it's important to know that. And then finally, as the patient is exiting out from the hospital, we need to plan the discharge process. Very important. Exactly what was just said before. What is the need of that patient? What are the different safety standards that need to be put in place? Do they go and participate in an adult day health program? Is the caregiver ready to take that particular, now a new different state maybe because of the hospitalization. So our program, which is the memory support program, it's an evidence-based program and follows patients through the continuum. We follow the patient in the hospital and post-hospital, and then link them up with different community agencies. We may make a home visit because I feel sometimes patients just need that, that touch, and also to sit down with families and learn about how this disease can change. What does it mean? Do they work? Do they drive? And so on.
Yeah, there's so much involved, it seems, when they make that transition into the hospital and then from hospital to home.
Exactly.
And it sounds like your program tries to span that spectrum. Yeah, so that brings us then to the notion of what happens to people who go back home, people with dementia, who have different needs, perhaps than when they first went into the hospital. And that brings us to our next panelist, and that's Edie Yau. I'd like to introduce her. I've known Edie for a while, and Edie is the Director of Diversity and Inclusion at the local chapter of the Alzheimer's Association. And the local chapter actually spans quite a large territory, which is Northern California and Northern Nevada. And Edie is one of the most sought-after speakers who travels around to different locations, helping families understand what the Alzheimer's Association has to offer. What are some of these community supports? So, Edie, can you tell us more about that, please?
Sure. Thank you, Dolores. Well, certainly, I think it is really important for families to seek help, especially after they've received a diagnosis, but sometimes they're not sure. And that's also something that we can do. So the Alzheimer's Association, we're actually a national organization. One of the important programs we offer is the 24/7 helpline. So people can call us 24 hours, 7 days a week, anytime, and have a live person, a professional, talk to them about really any questions they have. One of the services that I think families find the most helpful is care consultation. So for example, my mom was just diagnosed with Alzheimer's. She lives at home alone. What do you recommend? Those kinds of questions. And we have staff who can really help families with their unique situation, think about some of the initial next steps that people need to take, and that can be tremendously helpful. I think anyone can go online and look for resources, but when you have gateway organizations, services like the Alzheimer's Association that have this expertise, it saves families that time and that just that headache of having to look for everything yourself.
And this helpline, you say, works 24/7.
That's right.
Huh.
Yeah.
Okay, now I imagine that most of the time the people who answer the helpline speak English. So what happens if someone calls where English is not their primary language or their first language? Do you have the ability to help them as well?
We do. We have staff who speak Chinese, Cantonese and Mandarin and Spanish. We also have a language line, so any language really we can get an interpreter to support that call. The other thing that we offer is education. So we do a variety of education, whether it's one-on-one or classes. So people should know that, in addition to just understanding their unique situation, also understanding the course of the disease, whether it be Alzheimer's or some other form of dementia. Another big piece of that is behavior management. understanding what's going to come up. How do I deal with the repetitiveness or the different types of behaviors one starts to show as the dementia progresses. So we offer a lot of education for free. The other thing we offer that I think a lot of people don't know about is support groups. So in addition to professional support, it's really helpful when people can see peers. So knowing that they're not alone, that there are other families who are dealing with the same type of disease or same kind of diagnosis. And we have support groups in multiple languages, in different cultures, all over the area.
So that's wonderful what the Alzheimer's Association has to offer. And I think probably many of our viewers were not familiar with all of the services, the array of services, and the language capabilities. So thank you for sharing that. And now the last part, it has to do with including a discussion about research in the continuum of care. And research is a very important topic, we think, because it will help to advance our knowledge and ultimately improve this continuum of care that we're talking about. So to address the topic of how research fits in, we have Dr. Nusha Askari. Dr. Askari is a neuropsychologist and gerontologist with many years of teaching experience, who is on the staff of the Stanford Alzheimer's Disease Research Center, where she interacts with families and she helps to provide education and outreach. So Dr. Askari, can you help us understand why is research included in this notion of the continuum of care?
Yes, thank you for inviting me to join this esteemed group tonight. Research spans across the circle of the continuum of care. It can be with healthy volunteers who have no symptoms of any type of dementia, be it memory loss or other forms of cognitive impairment, to people who might be having some slight memory issues and are concerned about that and possibly may have mild cognitive impairment. Or be in the early stages of dementia. And even some programs include people who are in the moderate and later stages of dementia. So depending on the research program, people across the spectrum would be involved in research. Why become involved in research? Because the more people who become involved, the better the representation we can have. The better we can then address the needs, the diverse needs of the people with dementia, with regards to services we provide, with regards to treatments, to interventions. Advancing our knowledge helps bridge some of the existing gaps in the research. And then it's important to point out that dementia can affect anyone, no matter what your background is, no matter what walk of life you come from. And by widening the net of who we have involved in research, we can therefore meet the different needs that people might have.
Okay. Well, that makes a lot of sense, yeah, and I appreciate that you're sharing that with us, because again, I don't think most people would think of research as being part of this topic.
Right.
So I know we have, something else you want to add?
So I also
Yeah,
wanted
go
to
ahead.
share that sometimes people ask me, well, what are the benefits in terms of participating in research? You know, what are benefits to me? And I would say one benefit on an individual level would be that you are leaving your mark. You are helping us advance our understanding and knowledge and services. So you are leaving your legacy, to be it to your family, your friends, your community, future generations. That's one benefit. Benefit I highlight at the Stanford Alzheimer's Disease Research Center for people is that they have the opportunity to interface with leading experts in the field, you who are using cutting edge tools and techniques and resources and technologies. And therefore, we do research such as looking at what are some of the genetic biomarkers that are contributing to people's susceptibility to dementia, Alzheimer's disease, Parkinson's disease, different forms of dementia. Another would be the imaging techniques that we use and the advances that imaging techniques have given us in terms of understanding what parts of the brain are being affected, and in turn then how do doctors address the different types of assessment tools we've developed, for example, are looking at how different parts of the brain are functioning. So the different diagnostic tools we've developed over time, how doctors are caring for the patients, all of these have somehow in one form or another resulted from research that's been done in the field. And the other thing I would say is sometimes people ask me, what is the benefit to the family that can come from research? Again, Alzheimer's Association provides some programs at the Stanford Alzheimer's Disease Research Center. We have outreach and education programs for family members who are caregivers, which oftentimes the caregivers are the family members. So that's another advantage. And these are all free to individuals who are eligible volunteers. So they get these services all free. And so I would especially also like to say that we are encouraging people from the underrepresented populations, from ethnic minority groups, to become involved because there's such a wide gap in our knowledge and understanding of their diverse needs. At the Stanford ADRC, we are reaching out to people in the Latino community and the American Indian community to become involved, so we're strongly encouraging their involvement. And then across on a national level, there are other ethnic minorities as well that are being encouraged to volunteer for research. So if I were to basically give one parting thought,
Yeah.
it would be that we should, for anyone, to become involved. I encourage you to become involved, to take advantage of the opportunities that are out there, and let's all band together and work towards a future without dementia. That's really what I think everyone can help.
Good, thank you. I think you've made it clear for the audience. And I believe we have a couple minutes left. So what I'd like to do is give our other panelists an opportunity to provide one final thought. You know, if you want to have a take-home message for our audience, what would the message be? And I'd like to start with you, Dr. Martin. What would you like the audience to remember from this presentation?
I would say that it's really important that for the person with dementia that it not just be one person with dementia and one caregiver as a unit, but that there be a whole team or group of people involved, that this is something that does take a village. It's really hard work, and it's important to have all those other supports built in as well from early on.
Okay, so don't think you have to do it alone.
Exactly.
Yeah, all right. And Dr. Ghatak, what would you like the audience to remember?
So I think, you know, in our work with families, I think it's really important for families to band together and understand and be educated about the disease, because when you have a productive individual who starts to manifest some of the symptoms, it can be very frightening. It can be really hard. And I think that the more we understand the disease, the more we include team members, community to recognize and how to make the, you know, what can we do to increase the potentials of the patient with dementia. And those are, there are some lots of good work going on in those areas where individuals can benefit. So working together.
So working together and finding the strengths of the patient, of the person with dementia, what abilities they do have that could be brought to the front more and encouraged more. Okay. And Edie, how about you? What would you like the audience to take away with them?
I think it's really important to seek out help. You know, I think I often hear families say, well, we're going to take care of it on our own. We don't really need any other support. I don't think it's either or. You know, you can have your family take care of your loved one and use community services. There are lots of services out there designed to help people with dementia, to help the families. We don't want families to burn out caring for this person, so seek out help earlier.
Yeah, yeah, I think that's an important message, because as I understand it, many people wait until there's a crisis.
That's right.
And then when that situation has occurred, then it's much harder for all concerned to do any problem solving and get help, and everyone is all upset. So yeah, seeking help earlier and then following up with it. So I think all of you have really emphasized that, the importance of reaching out and being willing to receive services. And I believe in some cultural groups that may be a little more difficult than in others, you know, where there's more of an emphasis on independence or interdependence of the family and not bringing in outsiders. You know, so it's complex, but I think we've given our audience a really good feel for what we mean by the continuum of care and what resources we have. It's remarkable in this community what we have available, and yet not everyone knows about it, so I think we've made people much more conscious of what we have, and I hope people will take advantage of our various services. And I believe now we're just about out of time, and I'd like to thank our panelists greatly, very much, for your time and your expertise in sharing with us. And I'd also like to encourage our viewers to seriously think about volunteering for research at the Stanford Alzheimer's Disease Center. We have many different projects going on, and we would love to hear from you. The number that is being flashed on the screen is the number that you can call for more information, to learn more about our center, to volunteer. And as Dr. Askari pointed out, we encourage people with many different stages of dementia or people with no symptoms at all who would like to volunteer and contribute to future generations. So thank you very much for your time and attention and for being interested in our subject matter, and we hope you will give us a call.